Hello and welcome to this week's edition of Health Talk. I'm Peter Ndoro, and today we focus on South Africa's COVID-19 vaccine rollout plan. And coming up on the program, we'll be watching an insert filed by one of our reporters in the Northwest Province about logistical challenges that are being faced by some of the elderly there. We then speak to the Deputy Director General of Health from the National Department of Health about South Africa's COVID-19 vaccine rollout plan, which started against the grim background of a third wave of the coronavirus infections, and that's been hitting the country, as you might have been seeing recently. We also speak to the chair of the Ministerial Advisory Committee on Vaccines about South Africa's phase 2 of the national COVID-19 vaccine rollout, this time focusing on the safety and efficacy of the vaccine. And then finally, we'll be getting advice from one of our regular doctors on the program, answering questions about COVID-19 that some of you have been posting on social media. And of course, our fear is you just don't know what answers you're going to get. So you'll hear from a professional and get sound advice, and that's all happening towards the end of the program. But first, let's start where we always do with our senior producer, Zama Buthelezi, who take us through the latest South African COVID-19 numbers. Zama, thanks for joining us always. COVID-19, are those stats still creeping up? Is the third wave something that looks like it's gaining?
Definitely, Peter, it is gaining momentum. The numbers are growing, the active numbers are growing as well. A very good morning to you, and happy Africa Day for yesterday. I didn't see you. Good morning to Health Talk viewers as well. COVID-19 levels of new infections and active cases in most provinces of the country continue to increase. Lately, we continue to see national statistics of COVID infections topping the 2,000, 3,000 mark, as some provinces are already on the third wave of this pandemic. This happens also when coronavirus variants first detected and are dominant in India and the United Kingdom landed in South Africa a few weeks ago. Also, the second wave of the country's vaccine rollout began last week on Monday for South Africans over 60, along with healthcare workers. Government says it aims to vaccinate at least 5 million citizens older than 60 by the end of June. We'll keep you posted, of course, on that. The South African Broadcasting Corporation's News and Current Affairs Division this week launched the hashtag Cover-Up campaign. This campaign comes amid the rise in COVID-19 infections and increasing fears of the third wave of the pandemic, and also coincides with the country's second wave of the COVID-19 vaccine rollout program. Well, the campaign's primary objective is to create awareness and encourage citizens to continue adhering to non-pharmaceutical preventative measures to cap the spread of the coronavirus. In the next 3 weeks, we'll see SABC News intensifying its efforts through this campaign to promote the wearing of masks, hand sanitizing, and maintenance of good hygiene in all essential spaces. For now, though, let's take a look at the national COVID-19 statistics. To date, 11,406,308 tests have been processed in the country. Positive cases recorded 1,640,932. 94.1 recovery rate has been recorded. Total recoveries 1,543,951 cases. Active cases, we are seeing an increase. We are now at 41,005 cases, and sadly 55,976 people have succumbed to COVID-19 related illnesses. And like every week, we're sending our sincere condolences to family members. An increase again in new cases. We are now at 3,084 just in the last 24 hours. While we are seeing a 94.1% recovery rate across the country, new infections continue to increase in some of the provinces with big metros. And as Gauteng leads with infections and the province having entered the third wave of this pandemic, it is now more than ever critical for Gauteng residents to take extra care and continue to take precautionary measures, and most of all avoid mass gatherings which have been deemed as super spreaders for the virus. For now though, let's take a look at the infection numbers recorded in these provinces. In the last 24 hours, Gauteng has recorded 1,445 cases. Western Cape follows with 222 cases. KwaZulu-Natal with 154 cases. Eastern Cape with 80 cases. The three provinces, being the Northern Cape, Northwest and Free State Province, continue to record high numbers of new infections, and according to reports, the rise in these cases was a result of cluster outbreaks. These provinces, according to reports, have increased testing and contact tracing to contain the situation and limit further spread. The Free State Province is now on the third wave of the COVID pandemic, and government is focusing on the response in the Free State. For now though, let's take a look at the infection numbers recorded. In the last 24 hours, Free State has recorded 435 cases. Northwest has recorded 363 cases. Northern Cape, 254 positive cases. Mpumalanga follows at 94. And lastly, Limpopo with 37 new cases. So to prevent the spread of the virus and the third wave across the country, we are still urged not to become complacent as the virus is still around. So let's continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public. We must all continue to practice social distancing and ensure proper ventilation indoors. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a free number, 0800 029 999, and alert them to your symptoms. Remember, protect yourself to protect others. Thank you so much, and back to you, Peter.
Thanks so much. And I guess we just have to be vigilant. I think even more so at this stage, because the last time we didn't have all these variants floating about.
Yes, and other countries, like I say every week, have vaccinated a lot of people compared to us, but they are already seeing an increase as well. So we cannot afford to be complacent. We need to take precautionary measures, and SABC has come in to push this narrative of please take care.
All right, so go and wash your hands. Thanks. All right, that's Zoma with those statistics. But do remember that as we observe and report on these COVID-19 cases, the numbers can and sometimes do change quite significantly, so just bear that in mind. Now, this is very much your program, so you can be part of the show, and all you'd like to do, if you'd like to ask some questions from our guests, well, you could share whatever's on your mind even as well about what we're discussing. And the number to use is Johannesburg 011 714 5861. That's 011 714 5861 or 5877. Those are the numbers you can use. You can also share your thoughts with us on social media. We'll be monitoring that. And our Twitter handle is @SABC Health Talk. And we're also on Facebook. And our Facebook page is simply SABC Health Talk. All right, Health Talk continues right after this break. We'll get right into this vaccination story. Stay with us. Welcome back. You're still watching Health Talk. Now, phase 2 of the COVID-19 vaccine rollout is in full swing now in the Northwest Province. Now, this province has so far received more than 40,000 doses of the Pfizer vaccines. However, the majority of the elderly don't have internet access to register for the jab. The Provincial Health Department says that it has campaigns to ensure that all are assisted. Our reporter Tebogo Pagedi was there and filed this report.
Dipuo Lefotle is 69 years old and is waiting for the COVID-19 vaccine. She says it is important for her to get vaccinated as she has been living in fear since the coronavirus outbreak. However, she's unable to register herself.
I
don't have internet access to be able to register. I don't even know how to, but I have hope that government will help us. I have been patiently waiting for this vaccine for so many months after hearing that it has been found. Whether it comes day or night, I am ready. I want that jab to be able to protect my family and myself.
The elderly are able to give their details at their local clinics but have to make their way to vaccine facilities. Many, like Lefotle, are still patiently waiting to get a jab.
We went to the clinic and health officials took our details and contacts. They said we'll get vaccinated. I have no doubts. I'm intending to get a vaccine to protect my health.
Others are already on the queue to get their Pfizer jab.
I am happy that I'm here to get a vaccine jab. We should all be. Let us not listen to the conspiracy theories. I'm also happy that I'm here to get a vaccine because I'm scared of this virus.
Those who got the jab are delighted.
I came here around 9 and got a jab around 1. I feel well. There's nothing wrong. I am happy. They told us that the vaccine does not protect us 100%. I'll still be vigilant, but at least now I'll be less worried because I got the jab.
My body feels well. I am good. It is good that we also have a vaccine here.
The Health Provincial Department has registered 60,000 elderly people and intends to register another 300,000. It says it will pursue other means to register more people.
We are assisting the elderly in terms of registration, one, by ensuring that we are talking to the young people at home to assist them to get into the EVDS system, to register them, because all they need is the ID of the parent and the address, because not all of them will be able to register via their cell phone or access to internet. We are going to arrange, this is the plan of the department, to make outreach, to have outreach. We are going to be using SASA points, where they will be going to SASA points, and as they come to the hospitals, we'll be able to assist them. It's very encouraging also to see that some of the horses, the chiefs in the province, are very enthusiastical and saying that they can avail their tribal halls to be used for vaccination.
The department plans to conduct door-to-door visits to register residents who live in areas with poor network coverage. Residents are encouraged to log on to vaccine.enroll.health.gov.za and register online, or use the WhatsApp line 0600 123 456. Tebogo Pagedi, SABC News, Zeerust.
Now, after the break, we'll be speaking to Dr. Anban Pillay, the Deputy Director General of Health at the National Department, all about South Africa's COVID-19 vaccine rollout plan. Stay with us for that. You're watching Health Talk. Now, the government's electronic vaccination system, known as the EVDS, sent out text messages for COVID-19 vaccination appointments. All the healthcare workers and people of 60 years or older who received messages got the notifications at short notice. And so mostly in the afternoon or at night before the day of their appointments. Now, due to a glitch in the system, this resulted in many of them being unable to make their appointments and has led to questions on social media about how to register or reschedule appointments online. To help us understand the logistics and the progress of COVID-19 vaccination rollout, we're now joined by Dr. Anban Pillay, who's the Deputy Director General of Health at the National Department. So thank you so much indeed for joining us and welcome to the program.
Good morning to you, Peter, and good morning to the viewers.
So as soon as this vaccination rollout was spoken about and it began, I think there's been great anticipation of when we will be next and how it will work. So take us through the registration process. How does one register and how does one get on the list and what happens?
So I think it's important to say that we've got an electronic system for the registration as well as monitoring of the administration of the vaccine. And that's really important because that effectively manages the entire vaccination system on a digital platform. The EVDS system, which I think many of the earlier people interviewed spoke about, is an electronic system where you provide your information, your name, your ID, and where you live, etc. And the purpose of getting that information is then to identify which would be the closest health facility for you in order to access the vaccine. And the reason we're doing that is we want to create a systematic, orderly mechanism by which people receive their vaccines. And clearly the quantity of vaccines available does not match what the entire population needs immediately. And we're going through a process of prioritization. As you would have noted, we started with the over 60s. So we want the over 60s to come through. We need to be able to contact them. The EVDS allows us that kind of a mechanism to do that. Now, if you want to register on the EVDS, well, the first mechanism is going online with your computer or your mobile phone that has internet access, and you should be able to easily register. If you don't have that, you can use what's referred to as a USSD application, which is free, and you'll be able to register using that application, so you don't need a smartphone for that. You can also use the WhatsApp application, which is better than using the online because it uses much less data. And then you could certainly call the call center and they could assist you with the registration process. So you could share information over the phone and the call center staff will then assist in that regard. And if all of that is not possible, you could also go into a vaccination center and get registered. And you also, I think, heard in the clips that many of the provincial departments are going out to the points where we would likely find over 60s, such as the SASA pay points or even some of the supermarkets, etc., on Pensioners' Day. So likely to register people through that process. A lot of people as well are pitching up at the public sector sites for vaccination, and they get registered there. And if there isn't a long queue, there you may well be offered to be vaccinated as well on the same day. It just depends on how long the queue is, how many people are in the queue, and what stock of vaccine they have available at that particular point in time. So once you receive your SMS to say you've been registered, you then need to wait for the second SMS, which tells you that you need to go for a vaccination at a particular site. That may be a public site if you don't have a medical aid. It'll be a private site usually if you have a medical aid. But those do differ depending on the proximity of a particular site and which sites are available at some point in time. So public patients may well be referred to private sites, and similarly, patients with medical aid may well be referred to the public system. So when you receive that date and you receive there's a code that you receive as well with the time, you would go to the venue that you've been advised and wait in the queue. They will just confirm the details. They would have it on their system as well because the EVDS sends the same report to the site. And once they confirm your details with your ID, You will then proceed to the vaccination process, which shouldn't take you more than 10 minutes at most to actually be vaccinated. And once you completed vaccination, you would need to just wait for about 15 minutes just to make sure you experience no adverse effects, and then you usually are asked to continue and go home. There may be some minor pain, etc., but that doesn't last very long. If there's a second dose required, then you will be given the date for the second dose. In the case of the Pfizer vaccine, it will be 6 weeks. So you will receive an SMS closer to the time indicating where you'd need to go to and what time that would be in order to get your second dose.
All right. As you can imagine, we're going to get some calls during our conversation from citizens. So let's go to Noella, who's in the Western Cape. Very good morning to you. What question do you have, Noella?
Yes, I have registered for both my husband and myself, but I have received no SMS to verify this. So I tried to re-register yesterday, and they said, no, they've got my registration, but my husband's registration they did not have.
All right. Let's get an answer for you. Dr. Pillay?
So when you register, you usually receive an SMS. For some reason, which we don't understand technically, some people do say that they haven't received their SMS. And my advice to such a person such as Noella is just to go back into the system, and if you enter your details again, after the first page, it will tell you that you are actually on our system already. There's no need for you to continue to register. If you're still having a problem, you can call the call center, and the staff at the call center will be able to assist you as well.
And a question for you is, some people are saying, why are you prioritizing people over 60 over people with comorbidities? Because some comorbidities are actually at higher risk than people of a certain age.
So we've done the clinical assessment, what we call the hazard ratios, in order to understand who is at greatest risk and what are the factors that contribute to risk. So the highest risk is certainly age. So a person who is over the age of 60, particularly over the age of 80, is at extremely high risk, and that risk declines from the age of 80 to 70 and to 60. An individual who is below that age with, for example, a comorbidity is still at lower risk than a person who is over the age of 60. Simply because the age seems to play a much greater role than the other factors in terms of risk. And we have this data from our hospitalizations linked to the COVID outbreaks over the first 2 waves on the DATCOV system. So the actuaries have done the analysis, and I think there's actually quite good agreement around this, that age is the biggest risk factor. And while the comorbidities are also a risk factor, they are not as significant as age. So after we deal with issues of age, we will move certainly to the 50-year-olds and above, and then the 40-year-olds to above. So everybody will eventually be covered. And as you know, most of the comorbidities are in people who are over the age of 60, given that many of these comorbidities do arise when you age.
All right, let's hear from Tandy, who's in Pretoria. Tandy, thanks very much for coming through. What question do you have?
No, my question is that I'm one of the over 60s on pension. I've registered online in April, but we are not hearing anything about the area Acacia. And we've got a hospital, we've got a clinic, we've got discounts, we've got clicks. Why can't they allow us then to go if ever we must pay for that vaccination? Because it seems that we are being neglected. Is it only because we are staying in suburbs, or we don't understand? Okay.
Dr. Pillay?
I'm assuming it's Acacia in Pretoria.
Yes.
In the Swane district, I think there are 5 vaccination sites at least. I know they were going to open more. There's one in the city center at Sammy Marks. I know there is one in the north as well. I can just share the exact details with you of the other sites as well. There's one in Eersterust I'm aware of as well. I can certainly share this with the team, and you could get back to the caller. If you went to any of the public sites, they would certainly be able to do the vaccination if an individual is registered on the EVDS.
Dr. Pillay, can people start registering now, even if they're not over 60, or are you just encouraging people in the band that you're dealing with to be registering?
Peter, we're encouraging people in the over 60s to register first. We'd like really to deal with that group simply for the reasons that I outlined before. We will certainly be opening up to the 50 to 60 and then the 40 to 50 in that order. And I think in the next couple of weeks, we'll certainly be doing that, yeah.
All right. Can you choose which jab to have? I mean, I would prefer the single jab, I guess, you know, for convenience sake, but that's not how it's going to work, I guess.
Yeah, well, you can't really choose. Well, currently we don't have both vaccines. As you know, there's a delay with the Johnson and Johnson, so we currently only have the Pfizer across the country, and that's a 2-dose. But at any site, at any point in time, they will only have one type of vaccine. So when you go to that site, you'll only be offered that type of vaccine. Yeah.
All right. What happens if
generally speaking, in the rural areas, we would be using more of the Johnson and Johnson when it's delivered to us, given the temperature issues, and the Pfizer vaccine we would prefer to use in the more metropolitan urban areas because it's easier just to manage from a cold chain perspective.
What happens if you miss an appointment? Can you reschedule, or what happens? Can you just show up?
So if you miss an appointment, the system will be aware that you didn't pitch up, because if you did pitch up, you would be vaccinated. The system will then send you a second reminder of a second date, and we'll hope that you then go in and get vaccinated. If you miss that, you have a third opportunity, and you'll do the same thing. If after 3 times you fail to go to the appointment dates and times that were provided to you, you'll then be advised to go in as what we largely call a walk-in, which would be a person who's standing in a queue and just wait for an opportunity when you can be vaccinated after obviously those who have bookings have passed through.
All right, so we have another caller, Cynthia, who's in Johannesburg. Cynthia, good morning to you. What would you like to ask?
Good morning to you. I'm a lady of 75 years of age. They never gave me a number, and I'm just wondering what am I supposed to do? When can I go for my vaccination?
All right. So, Cynthia, did you send the SMS? Did you register?
Yes, we sent an application, sir. Yes, we did.
All right. Yeah. And you haven't had any SMS telling you that you're registered?
Nothing. And it's my husband at the same time as well. He's a gentleman of 80.
All right.
C. Aronovitz. Mr. R. Aronovitz. I'm C.
Okay. This seems to be something that keeps coming through, Dr. Pillay.
Yeah, so in the case of Cynthia, I do think that she can do 2 things. One is she could certainly share her details with the team, and I'm happy to assist her offline. But the other thing that she could do is go back into the system and enter her details. And usually, if she is on the system, it will immediately say to you that you've already been registered on the system. Then she would certainly know that she's been registered. If she's registered, then she would just need to wait for the date on which she could then go into a site and get vaccinated, because there will be an SMS, as I said, indicating that you would need to go to this site on this time, and they would give you an authorization number.
All right, and then what happens to people who don't have IDs, passports, perhaps even refugee numbers, that kind of thing? What about illegal people in the country? There's still a risk to society at large. Can they still get vaccinated?
Our intention is to vaccinate them. We're on the EVDS side of things, trying to make provision for that kind of situation. Bearing in mind that a person needs to have some form of identification so that you're able to know who it is, and then if they do have an adverse event, etc., later, you can follow them up, as well as for the purposes of the second dose. So the team is working on what are the other options that are are verifiable, that an individual would have in the form of identification, so that those that are not South African can also be vaccinated. Currently, foreign nationals can be vaccinated if they use their passport, those that are working in South Africa, but those without documents, a little bit more difficult, and so the IT team is looking at how do we put them on the system.
All right, Dr. Pillay, we'll leave it there. Thank you very, very much indeed for their update. Thank you.
Thank you, Peter. Okay, nice.
Thanks. That was Dr. Anban Pillay, the Deputy Director General of Health at the National Department. After the break, we speak to Professor Barry Shub, who's the chair of the Ministerial Advisory Committee on Vaccines, about South Africa's COVID-19 vaccine rollout plan and the efficacy and safety of the vaccine. Stay with us for that. Welcome back. You're still watching Health Talk. Now, South Africa has begun the second phase of its public vaccination campaign, targeting people aged over 60. Now, healthcare workers have received the Johnson & Johnson vaccine, whilst the Pfizer vaccine is being rolled out as a part of phase 2 for the members of the public. A crucial aspect of the vaccination campaign is tracking any adverse reactions. It's imperative that all health events after vaccination are properly investigated and monitored. Globally, it's acceptable that some mild and short-lasting symptoms following vaccination may happen, but moderately severe and severe side effects aren't acceptable. To help us understand the efficacy and safety issues of the vaccines, we're now joined by Professor Barry Shub, who's the chair of the Ministerial Advisory Committee on Vaccines. Prof, good to have you on the program again. Welcome to you.
Thanks very much, Peter. Great to be back on again. Thank you.
All right, so we've done quite a bit of vaccination already. I mean, it's been the healthcare workers, and we've been monitoring them and checking their side effects. What does the data tell us about these side effects? What are the typical symptoms that people get after they've been jabbed?
Yeah, look, the most common one, and I think probably most people will get some tenderness, maybe a bit of pain at the injection site, where the injection was given. There may be a little bit of a rash around there for people that are a bit more allergic to these things. But that's probably the most common side effect. Some people might feel a little bit out of sorts with a bit of a headache, a bit of muscle pains. They may even have a low temperature for a day or two afterwards. But that's really about it. I've heard of one or two people where the side effects may last quite a few days. But, with the ordinary Panado or aspirin, that can probably kind of, take care of that. So those are probably the great majority of side effects. And that will affect probably about maybe 30–40% of people.
All right, and we've had no medical event as a result of vaccination so far?
No, we've had no kind of serious side effect of the vaccine. No, there are what we call adverse events. In other words, these are things which happen to people generally. People do have health issues, and it's really it's the job of what we call pharmacovigilance, where they kind of, track and monitor after vaccines what happens. Where they look, is this something which is just happens to be at the same time, what we call temporally associated, or is it due to the vaccine, what we call causatively associated? And all these adverse events have to be investigated. There's a National Immunisation Safety Expert Committee, or NISEC, which looks at this, and they will examine all these adverse events and see, is it due to the vaccine? And so far we haven't had any of those. There have been a few of the healthcare workers who've been vaccinated who have still got infected, what we call breakthrough infections. But that has been a very small number. Of the 500,000 people that have already been vaccinated for the healthcare workers, this is probably of the order of about 20 or 30 of these breakthrough infections. So very uncommon.
All right, we are probably going to get a few callers coming through as we chat. And let's go to Evelyn, who's in Cape Town. Evelyn, a very good morning to you. What would you like to ask?
Good morning, sir. Sir, I would like to just ask, I'm on warfarin, which is a blood thinning tablet. And so I'm allowed to there's certain foods I can't eat because of this tablet. So I was just a bit concerned. Can I take the vaccine?
Okay, good question. Thanks very much.
Thank you.
Prof?
Complication which got quite a lot of publicity.
Prof, I'm going to ask you to start again because we didn't catch the first bit of what you were saying, and I suspect it's quite important.
Okay,
Yeah.
sure. Sorry about that. The blood clotting complication, is it coming through
Yeah,
now?
yes.
Yeah, the blood clotting complication has been reported with the Johnson & Johnson vaccine, but as I mentioned earlier, extremely rare. It's about less than one in a million doses. So I do have to mention that. However, I think it is important that people that are on blood thinners like warfarin, they should alert the team that's doing the vaccination. And because they can kind of give you some advice what to watch out for if on the extremely uncommon situation you might get that side effect. You know, it will be a persistent headache or persistent tummy pain. Then you'd need to kind of alert the doctors because it can be treated. So the bottom line is, yes, you should get the vaccine. It hasn't been, by the way, not been reported with Pfizer vaccine, which is what's been giving out now. But in any case, I still think, you know, alert them when you go for the vaccine so that they are aware of it.
All right. And
still go for the vaccine.
Okay, let's talk a little bit about the MED safety app by SAPRA. There are few myths and issues that are out there at the moment, and I'd like us to go through some of them, starting with this one that says, I already had COVID-19. I will not benefit from taking the vaccine. Your thoughts on that?
No, I think you should still go for the vaccine for a couple of reasons. First of all, the immunity after having COVID, well, first of all, if it was in the first wave, then in other words, you would have had the infection with the previous strains of the virus. There's inadequate, not sufficient immunity from that exposure. If it was a second wave, in other words, at the end of last year, beginning of this year, then it would be with the 351 variant, the one that we worried about. There would be better immunity, but still, the immunity is not all that great after infection. You would need to be boosted, have a booster of the vaccine. And that will be to your benefit because it will boost your immune response and give you actually a very good response, seeing that you have been infected before. So people that have had COVID before should still get vaccinated. I think there should be at least a delay of about 4 weeks after you've had the COVID before you have the vaccine.
All right, and another one says the vaccine will alter your DNA.
No, I know that's one of these conspiracy myths, and that is biologically totally impossible. The reason being is that the vaccine, the Pfizer vaccine, is a little piece of what you call the messenger RNA. That's the genetic signature of the virus. It's a little fragment molecule which is very fragile. So it gets into the muscle cell and it doesn't last for very long. And it can't get into the nucleus, where the DNA sits. So there's no interaction whatsoever between that fragile molecule, which lasts maybe a couple of days before it disappears, and the DNA. So that's completely biologically impossible. It's a myth which people have been propagating on social media, and it's got no scientific basis whatsoever.
Some people are really worried, saying that we don't know what's in the vaccines.
No, on the contrary, these vaccines have been so thoroughly researched, so thoroughly examined, so rigorously examined at all stages. First of all, when they were in clinical trials, and now when they've been rolled out, but also our licensing authority, SAPRA, the South African Health Products Regulatory Authority, they go through an examination extremely rigorously, from the water that's used to the glass which was used. Everything's gone through. All the I's are dotted and the T's are crossed. And that's after it had international auditing, which is even more thorough. So we do know exactly what's in the vaccine.
All right. And then another one that keeps coming through, there's a microchip in the vaccines.
That's even more far-fetched. Now, these are science fiction things which somebody dreams up and they put it onto social media. There's absolutely no way there's any microchip. It's absolutely, totally impossible. These are vaccines which are, as I mentioned, so rigorously examined. There would be absolutely no way that any contaminant, let alone a microchip, could get into the vaccine.
And then perhaps the final one that's come through, you can test positive because of the vaccine.
No, the vaccine will produce an immune response, in other words, antibodies and cells which are involved in the immune response, but not the virus itself. So in other words, if you test positive, it means you've been infected. And that's independent of the vaccine. The vaccine is supposed to prevent that. But, the vaccine takes anything from 2 to 4 weeks for that immune response to kick in. If one gets infected before that time, even after you've been vaccinated, the vaccine won't prevent infection. So if you do test positive, it means you've been infected.
All right, and just to be clear so that people understand that a vaccination is not a cure. What it is teaching your body how to recognize the virus and what to do when it arrives. Is that correct?
Absolutely correct, yeah. The way it works is that the genetic component in the virus, which makes what's called the spike protein, it's a spike which the virus uses to attach to the cells that are infected. So the vaccine takes that genetic code, making that spike protein, puts it into your arm, gets into the cells. Once it's in the cells, the muscle cells in the arm, it then makes that protein because that genetic signature is there. That protein then stimulates the immune system, and that educates the immune system that if you do get that virus, it'll mount an immune response to protect you from being infected.
All right. Does it have an effect on somebody's immune system, compromise it in any way?
Sorry, Peter, you broke up. You said it again?
I was saying, does the vaccine have the potential to affect the immune system negatively, compromise it in any way?
Sorry, could what compromise it?
The vaccine. By taking the vaccine, can it compromise one's immune system or...
the vaccine?
Yes.
Not at all. Not at all. In fact, the contrary is the case. What the vaccine teaches your immune system against that particular virus or particular protein of the virus, the spike protein, and nothing else. So it's got no effect on the immune system other than that.
All right, so what do we know so far? I mean, I guess these still are early days, but you get a shot today, maybe it's the one-shot one. It will start to kick in. How long are we predicting that you'll be safe from the virus for before?
Yeah, that is a $64,000 question. How long does that immune response last for? Unfortunately, we don't have the answers yet because it's too early. Now, these vaccines have only been around this year, so it's too early to say how long the immunity is going to last for. Our feeling from the studies that have been done is that probably it's going to last probably for a year or so, but we'll need to have boosters on a regular basis. We have annual boosters of influenza vaccine.
Yeah.
Now, this might be annual, but more likely and more wider, maybe every 2 years, maybe every 5 years, we will need to have regular vaccination to keep up the immunity. It's unlikely to be lost as long as, for example, measles. Measles vaccine gives you many, many years of protection.
Right.
This is unlikely to be as long as that. We probably will need to have regular vaccinations.
All right. Professor Schroep, we're going to have to leave it there. Thank you so much indeed. Always good to have you on the program. I guess the message is go and vaccinate.
Absolutely. Thank you very much, Peter.
Great. Thank you so much. That's Professor Barry Schroep, Chair of the Ministerial Advisory Committee on Vaccines. After the break, we'll be getting some advice on some of the issues that you've been raising on social media, but we want you to get a professional answer. We'll be talking to Dr. Marlin McKay. Stay with us. Welcome back. You're still watching Health Talk, and this is the part of the program that we try to debunk some of the issues that you have, myths and so on and so forth. A lot of you posting questions on social media and getting answers from all manner of people. So what we'd like to do is take those questions and get a professional to answer them for you. So we're joined by Dr. Marlin McKay, as we usually are. Top of the morning to you, Dr. Marlin. Welcome to the program.
Thank you, Peter. Thanks for having me again.
All right, okay, let's jump straight into the questions. Ania James says, hi, my mum had the Pfizer vaccine on Tuesday and 3 hours later ended up in hospital. She's since been discharged, but has debilitating headaches every time she moves. Has anyone else experienced something similar? She's off to the neurologist today and I'm very worried. I suppose this is early days, so we're starting to hear these stories.
Yeah, I think we're going to hear quite a few of these stories. I think the important thing to note is that association doesn't always mean causation. In other words, if she had a bad headache and the vaccine was in that vicinity, it does not always mean that the vaccine caused the problem. However, it really needs to be investigated. We do know, as Prof was saying earlier on, the vaccine is generally safe. The side effects after the vaccine range from painful arm. Yes, you may get a bit of headache, fatigue, body aches and pains. So it'll be very interesting to see what that final diagnosis would be, Peter. However, it is no reason for viewers to be fearful of the vaccine, and I'll still encourage everyone to make themselves available for the vaccine.
All right, and no neurological issues have been raised so far in terms of vaccines?
Absolutely not. Yeah. Absolutely no neurological issues. We mentioned the issue with clots and stuff like that, but I haven't come across any evidence of neurological issues. You're right.
All right, okay. The next one is from Kim Ashley Engelbrecht, who says, I've been feeling sick since Wednesday, flu symptoms with a sore throat. Went to the doctor on Thursday and he gave me some antibiotics. Tonsillitis now. A cough has developed since yesterday, but I'm due to go back to work tomorrow. I work at a preschool. Should I test for COVID?
Yeah, I think that would be a good idea, Peter. You know, especially if you are involved in a place where you are exposed to others, and in this case, children, your fellow colleagues. Obviously, they wouldn't be happy with you coming back if you're still on the antibiotics as well as now coughing. And I think it would be a good idea to have the test. A lot of the symptoms with COVID, especially with this wave now, overlap with many other things, whether it's a sore throat, upper respiratory tract infection, and sometimes we just don't know. And so in the interest of protection and the interest of limiting the spread of COVID, I would really strongly advise and recommend a COVID test.
All right, so we're getting into the flu season. So if you get flu-like symptoms, don't panic. It could just be flu, I guess.
Yes, it absolutely. And, you know, at least flu is a little easier because there's not much in the nose. It's a severe headache, dry cough, really bad body aches and pains, and a very high temperature. And it's acute onset. You know, it starts very, very quickly. And having said that, but flu can be just as dangerous, just as infectious. And I'm strong recommendation that we make ourselves available to take the flu vaccine. It'll be terrible if you have a co-infection influenza as well as COVID-19, and that can be quite detrimental.
All right. Jason Blake says, has anyone experienced severe toothaches, severe ulcer pain, ear pain, and ringing in the ears post-COVID? Does it get better?
Yeah, I don't know so much about the toothache, Peter, but I know ear pain, ringing in the ears post-COVID. Because it's an upper respiratory tract infection as well, you get this vertigo, dizziness, zinging noises, the tinnitus, very common. Abdominal pain is common, chest pain is common. The only reassurance that we can give, yes, it will probably go away. We just don't know when. It can be weeks, months, and of course it's still early days, so it does tend to diminish as we go along.
Okay, Makutana is struggling to sleep and is wondering if other people are experiencing this post-COVID.
Yeah, we have a lot of this, Peter. People who could generally sleep fairly well before COVID battle with insomnia, and I would recommend something like just melatonin to assist. Try and stay away from the conventional sleeping tablets, so-called Z drugs or Z drugs, which can be highly addictive, especially if you're going to be using it for some time. So try something more natural that is available without a prescription.
Lindiwe is asking about a runny tummy. Is that a post-COVID symptom, or could she be looking at something else?
Yeah, it can be part of COVID. There's a lot of cases where we have gastrointestinal symptoms. It can be post-COVID, and I think the main management of an acute diarrhea or runny tummy is replacement of fluids. And the classic recipe: 1 liter of water, 8 teaspoons of sugar, half a teaspoon of salt. That's your classic drip fluid or oral rehydration solution, and that can help. Obviously, if it's ongoing, then you may need to seek further medical assistance.
All right. Lee Sakanya says that it's been 3 weeks now not going to the toilet. Can you have 3 weeks without a bowel movement?
Ooh, that's a bit long. I would be very concerned there, and we worry about, are you passing flatus or winds as well? Is there perhaps bowel obstruction or something else going on? Usually that can happen post-COVID, during COVID, and especially, Peter, if one has been using a lot of medication, the anti-inflammatories or painkillers, this combination where they contain codeine. Codeine can also cause constipation. Also, the dehydration that may come along with not taking in enough fluid because one has been ill can cause that. But I would be seriously concerned with, 3 weeks is a bit of a worry. So I think we need to get help there.
All right. Catherine says, I had COVID a few months ago and I developed this tingly feeling on the left side of my back, which comes and goes. And months later, I still get it. Does anyone else suffer from this?
So tingling feeling usually indicates nerve, and we know that there are a lot of neurological sequelae from COVID. So it could be one of the cutaneous nerves, could be from the spine that have been irritated by the virus, a neuritis, inflammation that can cause that. Again, it will not be long. It won't be there for a long time. It will diminish, and there are some nerve pills that one, or with consultation with your doctor, can help from that. So that is quite common.
All right. Colette Joseph says, hello, Dr. Marlon McKay. Is it safe for me to take the COVID-19 vaccine with my egg yolk allergy? As I understand that most vaccines are grown in egg cultures. I've been told that the Pfizer vaccine is safe for me. What about the others?
Yes. So most of the vaccines, the older vaccines that we use for the most infectious illnesses were developed using egg cultures. But I can say to Colette that there's absolutely no reason to fear with the COVID-19 vaccines, be it the Pfizer, Moderna, as well as the J&J. And the AstraZeneca. It's not made in egg cultures, so it is completely safe for someone who has an egg allergy.
All right. Dr. Marlon McKay, always great chatting to you. Take care. See you again soon.
Thank you, Peter. Bye-bye.
All right. And that's where we say goodbye. Thanks very much indeed for joining us. We'll see you again next week at the same time. Have a great week and be safe, everyone. Bye-bye.